If you work with products that create dust, it's important to keep workers safe. Respirable crystalline silica, or RCS, is a harmful dust when inhaled, and it can cause serious and sometimes fatal illnesses such as silicosis. If you're an employer, you must take steps to protect the health and safety of workers. Health monitoring is one way you can do this, as regular monitoring identifies changes in a worker's health status from exposure to hazardous levels of RCS. Health monitoring must be provided if workers are involved in any ongoing work that creates RCS dust, even if respiratory protection is used to control exposure. Health monitoring may also be required for workers who are regularly in the vicinity of RCS or exposed in other ways, like cleaning work areas or equipment where the dust is present. So how do you know if workers need health monitoring? This depends on how often, how long and how much a worker is exposed to RCS. Both short-term high-level exposures and long-term lower-level exposures to RCS can have serious health effects. You must start health monitoring when you determine there is a significant risk to workers' health due to ongoing exposure to RCS. If you're unsure about the risk to workers, you should get specialist advice from an occupational hygienist. Health monitoring must be organised and paid by employers. In the case of labour hire workers, the host and labour hire company must first agree on who will organise and pay for the health monitoring. Health monitoring must be carried out by or under the supervision of a medical practitioner with experience in health monitoring. It will involve screening, a medical questionnaire, respiratory function tests, chest x-rays or a CT scan. You will then receive a health monitoring report with the findings of any test results. You must give the worker a copy of this report and also keep the report for at least 30 years. If the report recommends any changes to a worker's duties, you must implement them in consultation with the worker and medical practitioner. You must also provide a copy of the report to SafeWork New South Wales if the health practitioner tells you a worker may have contracted an injury or illness as a result of exposure, or if they recommend you take any remedial action, including stopping a worker from doing a particular task. Results of health monitoring and any previous adverse outcomes related to exposure to RCS should be included in any risk assessment and silica risk control plan. Do not include anything that will identify the worker, such as personal details or confidential medical information. Visit the SafeWork New South Wales website for further information and resources on health monitoring.